Hey nurse leaders! Whether you're on the surgical floor or in home health, preventing surgical site infections or SSIs is a critical part of post-op care. Today we'll break down what causes SSIs, how to prevent them, and how nurses play a central role in protecting wounds and saving lives.
Surgical wounds are classified based on contamination risk, clean. No entry into gastrointestinal, respiratory, or genitourinary tract. Clean, contaminated, controlled entry into these systems. Contaminated, open wounds or spillage from the gastrointestinal tract. Dirty or infected, wounds with active infection or necrosis. Risk factors for SSI include poor blood glucose control, obesity, smoking, immunosuppression, long or complex procedures, inadequate sterile technique, pre-existing infections or malnutrition. Evidence-based strategies for SSI prevention include preoperative phase, antiseptic showers for example, chlorhexidine wipes, hair removal only with clippers, not razors, antibiotic prophylaxis within 60 minutes of incision, blood sugar control, especially in diabetic patients. During the preoperative phase, several steps are crucial to minimize the risk of surgical site infections. Patients should take antiseptic showers, such as using chlorhexidine wipes. Hair removal should be done only with clippers, not razors, to reduce skin abrasions. Antibiotic prophylaxis should be administered within 60 minutes of the incision. And it's vital to maintain blood sugar control, especially in diabetic patients. In the intraoperative phase, maintaining a sterile field and proper hand hygiene are essential. The use of sterile drapes, gloves, and instruments is mandatory. Additionally, ensuring normothermia and proper oxygenation can significantly promote healing. Finally, in the postoperative phase, an aseptic dressing technique is key. Drains and catheters should be removed in a timely manner to prevent infections. And avoiding unnecessary dressing changes helps maintain the integrity of the wound. Signs and symptoms of surgical site infection include redness, swelling, or warmth around the incision. You might also notice purulent drainage or a foul odor. Fever or chills can be a sign too. Increased pain or tenderness around the wound is another indicator. If there's delayed wound healing or wound dehiscence, that's a red flag. Elevated white blood cell count or localized tenderness should also be monitored. Early recognition is key. Delayed treatment can lead to sepsis or extended hospital stays.
Wound assessment involves monitoring for drainage, odor, separation, or abnormal redness. Additionally, measure wound dimensions and track progress. Use wound scoring tools such as the RITA scale to ensure comprehensive evaluation. Wound management is crucial in preventing infections and promoting healing. First, change dressings as prescribed using a clean or sterile technique. This helps to minimize the risk of contamination. Next, if topical antibiotics are ordered, make sure to apply them as directed. This step can significantly reduce the risk of infection. Lastly, keep the wound clean, dry, and documented. Proper documentation ensures that any changes in the wound's condition are noted and can be addressed promptly. Systemic infection care, administer IV or oral antibiotics as ordered. Monitor vitals, labs, and signs of systemic spread. Report escalating symptoms promptly. Patient education, infection prevention starts at home. Teach proper hand hygiene before wound care. Demonstrate dressing changes if appropriate. Emphasize the importance of monitoring for fever, drainage, increased pain, not removing dressings prematurely, returning for follow-up visits. Reinforce smoking cessation and glycemic control for healing. Surgical site infections may be common, but they're largely preventable. With thorough assessment, patient teaching, and strong sterile practices, nurses are on the front lines of protection and healing. What are your go-to tips for preventing SSIs? Let us know in the comments. Like, subscribe, and follow for more surgical nursing essentials, powered by evidence and action.